Hi, everyone. We're so happy to have you, whether you are joining us here today or watching later from the Cure GABA-A YouTube channel. We ask that you please mute your mics if you have not done so already. And if you have any questions, include them in the chat box below. We'll have time to answer questions at the end of the presentation. My name is Monica Joanna Elnacave, and I am the founder and CEO of Cure GABA-A, a nonprofit organization with the sole focus to develop potential therapies for GABA-A variants. By partnering with renowned researchers in GABA-A and the organization of our patients for clinical trials. Today, we welcome Kim Hindrey. Kim is a project manager and brings a strong background in education and healthcare advocacy. For over 16 years, she has dedicated herself to teaching children with varying needs and actively participating in clinical trials to improve family-centered care and accessibility of healthcare in rural areas. Kim also serves on the FDA's Patient Engagement Collaborative, advocating for patient perspective. Kim will show us how Unite Us has expanded its reach to serve all individuals in need of essential care and services. Using cutting-edge technology, Unite Us fosters collaboration across different sectors to ensure that everyone, regardless of their background or challenges, has access to care that they require. I'm handing it off to you, Kim. Please share with us that is designed to empower our community members with easy access to healthcare information and choices.
Thank you, Monica. So I'm going to share with you a little bit about CNF, about our mission, and then also how you can access the Family Support Network. Cure GABA-A is actually a proud partner of ours in Unite Us. So you can actually access their assistance request form from the website and have access to a variety of social services and emotional support. So I'm going to share my screen with you so that I can share a little bit about CNF and how this partnership came to be with Cure GABA-A. So our mission here at CNF is to improve the care experiences of children living with neurologic conditions. And we do that by building meaningful connections with both families and medical professionals. We provide education support and care advancement for researchers. I'm going to focus today primarily, though, on the family support. So let's give an example of what family support might look like. So just recently, we actually had a family that was referred to us from a social worker in Chicago at a Chicago hospital. This family had a child who was terminally ill. The family was facing eviction if they didn't get $3,000 in rent paid for in the next 7 days. On top of that, they had just had a little baby daughter, who also was showing similar symptoms as their older daughter and needed to get genetic testing done. This family was desperate. Within 48 hours, we were able to connect that family not only to the genetic testing, but also to organizations that could help support them so that they weren't being evicted from their house in the next 7 days, and so that they would have the resources that they needed going forward. That's just an example of the kinds of family support that we can provide. Here at the Child Neurology Foundation, we service not only families, but we also service medical professionals and researchers. And we're actually the only organization to do that around the nation. Our community, as you know, includes GABA-A patients as well. And there are 14 million children in the United States that live with neurologic conditions. And our pediatric neurologists are getting fewer and fewer. And so it becomes even more important for us to build a community of support around the nation so that we can get our families the support that they need, not just medically, but also through social services and emotional support that doctors really don't have the capacity to do in their short clinic visits that they have. So we really stand on 3 different pillars. We stand on child and family support, education for families and physicians, and they can go to the Cure GABA-A website and they can fill out their assistance request form. It looks like a contact us form. Immediately they'll go into the Unite Us platform. In the Unite Us platform, they are able to get connected with our social worker, Vivian, who speaks both English and Spanish. When that referral comes in, our social worker picks up the phone and calls that family. Once she calls that family, she reaches out and she talks to them. That is the most important piece because she's building that relationship with the family, which is very important. Oftentimes families don't necessarily know that we can provide support with a lot of these different social services or that we can connect them to another family walking a similar journey. So letting them know that we can help them with whatever it is that they're facing at that point in time is extremely important. So we can connect them to our educational resources. We can refer them to another social service organization. That may be a food shelf. That may be helping them find employment, maybe filling out disability paperwork or finding respite care. That might be connecting them to another parent. We here at our foundation have a family support specialist on staff, but then we also have, as I said before, over 75 plus advocacy organizations, including Cure GABA-A, where we can refer families to get connected as closely as possible to a family walking their similar journey. Education is that other component that I talked about. Education is one of the most important things you can do to understand your child's condition and to learn different ways to help your child. We have education tools around transitioning a child from pediatric to adult care, genetic testing education. We have education around telehealth, school support services, and a lot more. We also have on our website a child neurologist new visit toolkit. This is really, I actually use this with my own daughter going to a child neurology visit where we were able to fill this out and really get our timelines in order when everything happened. And so you're not in that appointment at the last second trying to think back to when all of these things happened. You feel prepared. You're ready to talk about next steps in your child's care. We also have a respite care notebook. The respite care notebook allows you to jot down all the information that someone would need to know to look after your child if you were to take a few hours or days off from caring for your child. We have a transitions checklist. This is wonderful if your child is transitioning from pediatrics to adult care. And then we also have a seizure action plan. This is great to give out to your school providers or if you have childcare. It's just a wonderful so that everyone is on the same page and knows what to do if your child should have a seizure. We also provide resource navigation. So as I said before, we have a licensed English and Spanish social worker on staff that assists families in finding the needed resources. We think of anything from mental health services, as I said before, employment assistance, really anything and everything that you could possibly think of, down to clothing. We really do provide support finding. We look locally initially, and then we have the ability to look nationally in that Unite Us platform. That Unite Us platform is really organization facing. So it's a tool that we use as an organization to be able to find those resources and connect to reliable organizations that are going to support families. We also have peer support. As I said before, we really lean on our advocacy organizations to help provide this peer support because we want to get our families as close as we can to someone else who is walking a similar journey as them. Families want to know, what have you done before? You know, they want to ask those questions. What doctors have you seen? What's worked for you? What hasn't worked? Where can I, get my child involved in different activities or events? And where can I get the siblings involved, right? Because those are equally important questions. So this, idea of helping families find social services and emotional support is so huge. Our number one request is for peer support. Most of our requests, families want to connect with other families. So how do you connect with CNF? How do you connect with Cure GABA-A? One of the ways you can do that is by calling us directly here at this phone number. You can also email us, or you can just simply scan this QR code. If you have a need, a social service need, if you have a patient with a social service need, or want to get them connected to emotional support, you can easily fill out our assistance request form. You can go to the Cure GABA-A website. You can also fill out their assistance request form. It allows us so many possibilities to get you connected with the support that you need. So I highly recommend reaching out to us if you are in need. We are more than happy to help you, and look forward to connecting with you.
Thank you so much, Kim. That was so informative and very efficient. I have a question, actually. I want to start off the questions myself. So I have a daughter, her name is Eleanor, and we are located in California.
Yes.
And so we're going to be transitioning from the Early Starts program at Regional Center, and we're moving her to the Over 3, so child program.
Yeah.
Do you have any resources that can help us understand IHSS or anything that will help with that transitionary period?
And that is a huge transition, right? And there's so many different complexities from state to state with that. So we absolutely do. The process for that is literally filling out that assistance request form on our website. We can get you the information on connecting. Usually there's a local resource agency in your area that really helps that transition process and gets you connected to the tools and the resources that you need moving forward. Because transitioning even from early care to school age services is another transition, right? It's huge. It's different. It oftentimes will move from services in your house to services at school. And sometimes there are a lot of different variations in that. Sometimes you will have care that comes into your home even still at a school age. It just depends on what's best for you and your child. So there are a lot of different considerations with that, but absolutely, that's another service that we can offer and education that we can help support you with.
Wonderful. And we have one question. Joseph wants to know, you spoke on education. Do you have education on Medicaid and waivers? And then he has another question. Or is the education more about phenotypes like seizures? Can you speak more about education that you provide?
All of it. So all of the above. We'll give you the clinical information. A lot of the clinical information comes from our disorder directory, which is actually written by and vetted by neurologists and advocacy organizations. So we like to make sure that we have the most recent up-to-date information on our website. And as always, things are developing and new medications are coming to market. And so once there was a time when, there wasn't a cure for something, and then there was a medication, or not a cure, but a medication for something. And then all of a sudden there was, and that's something we are proud to update on our website and like to make sure that we are, always updating those things and happy to do so, because that means we are making changes that will better help our patients and better help our families. But no, we offer information across the board. Again, Medicaid and the waivers are going to vary state to state. So we do have the ability to connect to organizations that help understand that in each state and also help fill out that disability paperwork, because it is not always straightforward. It is very complicated from state to state. And so you oftentimes need someone to walk you through it. There's nothing else to say about that. It is just something that you need an expert to make sure that you are actually utilizing all of the benefits that are out there for you and your child. It really can make all the difference.
You are so right, because I feel completely lost in this process, this transitionary process. And I'm going to head to our website at curegaba.org and head over to the family support tab.
Absolutely. Yes. The more families we can help, the better. And I think that this is a service that has been needed for so long and that families haven't known where to find it at. It really hasn't been available. And now we're using technology to our advantage, and we're being able to help more families nationally. And that's a great feeling. It's a great feeling to be able to help as many families as possible.
Thank you, Kim, for joining us here today to explain how our community can get services such as childcare, income support, education, and so much more. Please visit our website at curegaba.com under the Family Support tab and fill out the form to receive access to these services. Thank you so much, Kim.
Thank you.
Talk to you soon. Bye.
Bye.